The U.S. population is aging and the need for hospice care is growing. But staffing shortages could put the level of care in jeopardy right now. The National News Desk's Angela Brown is looking into the staffing crisis.
Hospice care in the spotlight due to former President Jimmy Carter turning 100 while in hospice care for over a year. Still a trailblazer.
The former President Jimmy Carter making history once again, this time as the oldest person to get nominated for a Grammy.
A 2024 report found that the U.S. hospice market size is expected to reach $65 billion by 2030. Growth tied to an aging population and more acceptance of hospice, but with growth comes growing pains.
Do we have the staff for this?
I feel we're sort of in a crisis in healthcare for staff in general, particularly in nursing.
That crisis is trickling down to hospice care. Housh, the CEO of Good Samaritan Hospice in Virginia, is facing a shortage of nurses and nursing aides.
You know, we are limited in the number of patients that we can accept under our care based upon our staffing. Now, we will always make it work, and here at Good Sam, we always have done that.
Hospice provides end-of-life care to patients and comfort to family members. Hiring can be tough. It's a job not everyone can handle. And then there's cost.
I think the other thing that's plaguing people across the country, particularly in healthcare, is a growing cost of doing business, right? People expect more when it comes to wages and all those things than they've ever expected before, but not necessarily a growing reimbursement.
And this is an important number right here. The Population Reference Bureau says the number of Americans 65 and older is projected to increase from 58 million in 2020 to 82 million by 2050, increasing the need for hospice as well. Yeah.